there's so many entry points, right? There's so many ways you can get into this system. And honestly, we have some really amazing healthcare employers that are offering really good jobs with really great benefits and opportunities for you to grow. We don't have a single healthcare employer that we work with that isn't willing to upscale their workforce. And I think that that really speaks to their readiness to keep that system going, right? So we're constantly recruiting and filling or backfilling the pipeline with new talent while we're helping talent that's already in it grow and grow and grow. And, my favorite Good Jobs story is that we are able to, through Good Jobs funding, support Birmingham Promise students who are pursuing nursing degrees at UAB. And so through this program, we are not only helping people get in, like people who are maybe in their second career or who are looking to transfer from one industry into healthcare, but we're also helping to make sure that Birmingham City School graduates are becoming the next best and brightest nurses within our network. And it really doesn't get better than that. And so I think that that's my kind of North Star, is for that system to keep working and for us to really grow our own.
Hello, I'm Angela Abdul-Rashid, your host for the Prosper Connector podcast. This is a place where information is shared, connections are made, and great Birmingham stories are told by great Birmingham people. We have an amazing episode scheduled today with Sarah Wilson and Dr. Olivia Howell from the city of Birmingham. Before I let them tell you who they are and what they do, particularly with the Good Jobs Challenge, I have to ask you all the most important question of the day. If you were to think of our beautiful city of Birmingham as a food, what food would it be and why?
I'm gonna go with greens, collard greens.
Do tell.
Because I think everybody thinks their greens are the best, right? Like there's usually a very special way in which you do it. There is a person who's assigned to greens, and once you become that person, the only way you cannot be that person is for you to leave us. And so greens are like this thing that's really important. But every time you eat greens, it transports you back to being home or being comfortable. It reminds you of community. It reminds you of family. And I think that's what I think about in Birmingham.
I love it.
There's so many people who are not native to Birmingham, but they have a Birmingham story. And there's just something about Birmingham that feels like home. There's just something about Birmingham that feels like community. And I think that's what makes our city really special.
I love it. Dr. Liv, top that if you can.
I will try. That was a great answer, Sarah. I think for me, and I don't have just a specific food, but I would have to say barbecue food. And I say barbecue because of the rich history that Birmingham brings, and because of how much barbecue food can be inclusive, it's community driven, and who doesn't love barbecue food? You can go to other cities. I'm not going to name them, but you can be like, some have a love for it or a hate towards the city. Like, oh, they have this, or oh, they don't have that. But I feel like Birmingham has everything. And just like barbecue food, we have everything. It's something for everyone to enjoy with barbecue food. So that's what I would align Birmingham with.
I love it. And I love, as we segue into the actual meat of the matter, how both of your answers, to me, are indicative of the work that you do, particularly with Good Jobs Challenge. When you think about having something for everyone, that's what this opportunity is. It's really opening up pathways to healthcare and to advancement and to equitable employment opportunities and meeting needs within the community. And it's rooted in traditions of communities coming together. I think about greens, I think about tradition. It's rooted in having something, again, for everyone, being accessible. When you think about barbecue, it's something that we all can get, and we've grown to know that to be what our city is for. So let's talk about the Good Jobs Challenge. What is it in particular? And then tell us more about your role in this investment in our city.
Yes. We love good jobs. We are really excited about good jobs, and championing good jobs is one of our favorite things that we do in economic development with the city of Birmingham. I have the pleasure of serving as Deputy Director of the Department of Innovation and Economic Opportunity and lead workforce and talent development for the city. And about, I would say at this point, 3 or 4 years ago, right on the heels of the pandemic, The Economic Development Administration announced the notice of funding for the Good Jobs Challenge, which was really intended to place historically excluded communities into pathways to getting good jobs. And so we saw the notice of funding and we quickly said, wow, this has Birmingham written all over it. Our people are talented. Our people are capable of doing the jobs. We have great employers. And so we applied and we got the job, and then soon after stood up a team of people to support people inside the city of Birmingham, as well as external partners and stakeholders that were going to help us kind of carry this work. And Dr. Liv is one of them, and who's leading this effort for us, and we're really excited about that.
Wonderful. So, Dr. Liv, from your vantage point, why is this significant for our city?
Yeah, absolutely. So for me, it's significant because it includes everyone. It doesn't leave anyone behind, and it champions women, it champions people of color, and it helps get them placed into good healthcare jobs. And for me, it's not just something that is for them, but it's generationally, right? So it's something that would benefit their kids, because everyone needs healthcare. Everyone, needs some access points to that. And so being able to get placed, trained and placed into a healthcare role, it would just be phenomenal for folks to get a part of, to be a part of, and also for their families to benefit from it too.
So talk about what the process looks like. What is Good Jobs as it relates to the process and training and the partnerships that you all have built a village that are a part of this Good Jobs process, and what does it actually do and what does it look like?
Yeah, absolutely. So for starters, we have a website, goodjobsbham.com. And so from that website, you get to learn more about Good Jobs. You get to learn more about our partners and our employers as well. And so folks who are interested, they're able to go to the website, take this career roadmap. And I don't like to think of it as a survey or a questionnaire. I like to think of it as like a purpose-driven tool to determine, what do you want to do? Is healthcare right for you? If so, what job is right for you, right? And so they're able to take this tool, and then from there, our team at Central 6 reaches out within 24 to 48 hours to understand, okay, let me learn a little bit more about you and determine which program would be right for you if healthcare is the way to go. And from there, they get they get in contact with one of our subawardees to determine which training program is right for them. And then from there, they get in the training program and they get trained. Training programs last from 8 to 12 weeks. And then from there, after they're trained, they get placed into a job. And so our goal right now is definitely around placement and making sure folks get into that job. And so it's been really exciting to see folks want to learn more about healthcare, want to learn more about Good Jobs, and want to do something different and if not better for their lives.
Can you tell us some of the opportunities for training that exist through Good Jobs? What kind of jobs are they being trained for?
Yeah, absolutely. Becoming a certified medical assistant or clinical medical assistant, sterile processing technician, pharmacy technician, radiology tech, administrative medical assistant. We have the whole gamut. Nursing, we have a complete list. Anything and everything that you can think of, I'm sure we're probably training for it within one of our subawards.
I love it. Okay, so let's get down to the hard question. And Sarah, I'm going to ask this to you. I have worked on and with federal grants before, collaboration, partnerships, recruiting, retention, all of those efforts require work. Talk about the challenges. What have you all faced as you have executed this grant and with the ultimate goal to hire a certain number of persons and train them so that we do continue to grow and build our healthcare system right here in Birmingham? What has been hard about this process, and how can people help?
That's a great question. I don't appreciate that I got the hard question.
You can handle it.
No, I think the challenge is that it's new. Mm-hmm. We haven't done this before. The city hasn't done this in economic development before, so this was new for us. So, as with most new things, it required us to develop some new skills. The good news about that opportunity is that we have the makings of everything great. So, going back to the food thing, we have all of the necessary ingredients.
Yes.
And we have the recipe. We just were missing the people to do it. And I think that's why the city felt strongly about leading this effort and really standing in the middle is we are not the ones out there doing the hard work. Our wonderful, amazing partners are doing that work. But what I think we do really well and what has been, I guess, the remedy to that challenge is understanding that we have this convening power bring everyone together. And so being able to bring employers to the table, being able to bring nonprofit like service providers to the table, being able to connect training providers with these other two entities, and then also being able to create pathways for people who traditionally haven't had access to those good jobs in the past. I think that's been one strength. But when we applied for the grant, there were 3 phases to the grant. And the first phase was this like system development, right? Because we didn't have this system. We had the jobs, we had tons of vacancies, right? We're a healthcare town, so we knew that healthcare jobs were going to continue to grow. We knew we had people who, on the heels of the pandemic, were looking for work. And not just looking for work, but looking for a good job, right? Looking for a future somewhere where you can really dig in and find value. So we knew we had all of those things. So it was just really having to put those things together. And it sounds easy to say, okay, you got the puzzle pieces, just put them together. But it's taken us some time to get to this place. But what I really love about all of our partners and what Dr. Liv has really helped us lead is being able to ensure that what we're building right now for healthcare could apply to really any industry.
Absolutely.
And so the systems that we're setting up, what we've learned and kind of the mistakes that we've made, we'll be able to apply that to manufacturing, to sports and leisure, hospitality, all of the growing industries in Birmingham, to be able to say, like, you can get a job in any industry, right? And to Dr. Liv's point, it's really about matching people with their talent, skills, and interests, and making sure that they have opportunity to really realize that potential.
You handled that hard question really well. Pat yourself on the back.
Goodness.
You can breathe now. So to your point, though, it truly is a recipe for success in many different areas. Right now, we're talking about good jobs in the healthcare industry. What's on the horizon for the city for good jobs? I know that there are some opportunities coming up in March for people to participate in, but where do we go from here?
Yeah, absolutely. So I'm glad you teed that up. March 12th, we are having our Good Jobs Job Fair, and this will be a recruitment fair and also a placement fair for folks who are in our program, who have been trained within our programs, and folks who are interested in good jobs. And so it will be March 12th from 11 to 1 at the Boutwell Auditorium, and we'll have, if you need any assistance with getting there, with childcare, what have you, we have opportunities for that for folks who are needing that kind of wraparound assistance to get to the fair. But it's open for any and all who are interested in getting involved with good jobs.
And then what about partners? Are there needs for additional employer partners? Do we have enough in place? Is there opportunity for growth in that area?
Yeah, there have been need, and actually we closed on some of those needs in
Wonderful.
December. And so Prosper, of course, closed on the RFP, and we closed on the RFP at the city's level. And so we're actually in the process right now determining what additional partner we want to have come on board. As you know, the grant expires September 2025. And so right now, sort of to Sarah's point around challenges, time. And so now we're trying to say, okay, we have to work a little bit harder. We have to do a little bit more, especially since the grant is getting ready to expire. However, our work will not expire.
Wonderful. So what's the urgency right now? If you had a quick need that you needed filled right away, is it more participants? What is it that you need that we can help as a community sort of meet those needs?
Yeah, I would have to say letting us know what opportunities you have, because we have we have a wait list for folks who are interested in our program, and also folks who are trying to get placed right on the employer side, because we're running through a cohort model, and employers are also doing a cohort model as well. And so we're having sort of that gap, if you will, in terms of getting folks placed at a quicker level. And so for us is really understanding what needs you have immediately in terms of employers, because we can do a skills to skills match as opposed to a position to position match. And so for us, letting us know what opportunities do you have so we can help fill that, and also help upskill folks if you felt like our curriculum is not as paralleled as you wanted, we can help upskill them as well through our partners at Central 6.
So you're like an employment matchmaking sort of business in the area of healthcare. It's really knowing the needs and seeing who fits the needs, or as you mentioned, upscaling people. And that only benefits the participants when they grow and they gain more to be able to fit the needs that employers have.
That's exactly right. And I think too, to that point, we have resources, we have funding to be able to, whatever the gap is for that person or for that employer, we have the ability to fill that gap or to assist. And so part of this grant that was so amazing is that the EDA allows us to support wraparound services, which doesn't always happen in workforce development. And so whether it's childcare, transportation, whether you need supplies to be able to, like equipment to be able to get the job, whether if you need a stethoscope, I need to learn more medical equipment. That is literally all I got. A stethoscope. I can't spell it, but I know that there's a need for it. But whatever the gap is we can help fill that. The training is free. The supplies are free. So really it's, if there's a need out there, if you're an employer and you want to get plugged in, if you have healthcare jobs and you haven't been involved with us in the past, we want to get connected with us so that we can help you. If you're someone who's looking for a job and thinks that oh, wow, I never considered that healthcare could be for me, it is for you, and we can guarantee that you will be successful if that's something that you desire. And one thing I will also mention is that the city is leading this grant, but we are, this is a regional effort. So this opportunity is available for residents across a 7-county region. Do you remember those regions? It's a party trick to be able to name the counties.
Bibb, Walker, Blount,
Chilton, Jefferson,
Shelby. What are we missing?
St. Clair.
St. Clair.
Okay,
yes.
Our team. Yes.
But I think that's amazing that it is a city-led but regional impacted initiative, which is important. Yeah. It's important. I have one last question. What does success look like if we were to look a year from now, March 2026, and thinking about what would make you know that we as a city and a region have succeeded in this effort? What does that look like? And that could be an idea of a story behind one of the participants or an employer having vacancies filled by qualified, skilled residents. What is success?
I think to be more concrete with numbers, I think having 1,200 trained and 1,000 placed.
We will take that for sure.
Look like for sure. But to sort of a more broader spectrum is seeing the healthcare workforce more inclusive, right? To me, that's what success would look like, especially. Just got married, right? I want to have kids and all of that. So for me, it's like, what does it look like to see folks who look like me, who are helping me in the healthcare workforce, right? And also who are attentive to my needs, attentive to my pains, right? And so for me, I would definitely love for it to look more inclusive, for it to look more diverse. And so that's what success would look like on a broader scale to me, in knowing that we did our job and did it well.
Yeah, I love it. Sarah?
So I would say all of that, first, wonderfully put. I think also is that we have created a pipeline or a pathway system that works, right? And so that, one cog in that system isn't going to completely break it down, but something that has a constant churn. What I think is so wonderful about healthcare is that there's so many entry points, right? There's so many ways you can get into this system. And honestly, we have some really amazing healthcare employers that are offering really good jobs with really great benefits and opportunities for you to grow. We don't have a single healthcare employer that we work with that isn't willing to upscale their workforce. And I think that really speaks to their readiness to keep that system going, right? So we're constantly recruiting and filling or backfilling the pipeline with new talent while we're helping talent that's already in it grow and grow and grow. And, my favorite Good Jobs story is that we are able to, through Good Jobs funding, support Birmingham Promise students who are pursuing nursing degrees at UAB. And so through this program, we are not only helping people get in, like people who are maybe in their second career or who are looking to transfer from one industry into healthcare, but we're also helping to make sure that Birmingham city school graduates are becoming the next best and brightest nurses within our network. And it really doesn't get better than that. And so I think that's my kind of North Star, is for that system to keep working and for us to really grow our own.
And I think you said it best, that even after September 2025, the work will continue. And that's when you know that the work was worth it and that you get to see your legacy live even past a grant. And we want more opportunities
yes.
of this nature. That's my vision of what success looks like, that the blueprint has said that Birmingham can do this, that we can do it in another industry, we can do it in another area, and we can meet needs while also advancing people's lives and changing their lives. So thank you both for the work that you do. We're excited to reach 1,200.
Train 1,200 and place 1,000.
I want to say that one more time. Yes, that's important. That's a major shift in a community when you're able to say 1,200 people were impacted, 1,000 were particularly impacted specifically, and the employers and jobs are taken by people from our very own city. That's good work, good jobs.
Absolutely.
Thanks to y'all.
Good job.
Yeah, I know. Look
Good
at
job on the good job,
right? Kudos to you. Well, thank you, Dr. Olivia Howell and Sarah Wilson from the city of Birmingham for joining us today for the Prosper Connector podcast. We're excited to have you here and looking forward to the success of the work that both of you are doing and your partners. Thank you. I'm Angela Abdur-Rashid. Thank you so much for joining us for this episode of the Prosper Connector podcast. Be sure to subscribe to our YouTube channel and follow us on all your streaming platforms at Prosper BHAM. That's at Prosper BHAM. And while you're at it, visit our website at www.prosperbham.com. We'll see you next episode.